A shocking new report analyzing healthcare systems of high-income countries ranked the U.S. dead last for quality of care. This despite spending the most by far among the 11 wealthy nations studied. Joining us now to discuss is former health insurance executive turned whistleblower and president at the Center for Health and Democracy, Wendell Potter. Wendell, thanks for joining.
Thank you, Ryan.
Wendell, the outlines of this have been known for a while, but what new in this report jumped out to you?
What's new is what's the same, and that is that we continue to be dead last, and we've made no improvements whatsoever on any of the metrics. Since they started doing this, they being the Commonwealth Fund, they started doing this analysis and this research and these surveys in 2004. And I thought that after the Affordable Care Act was passed, we'd see some change. But we still bring up the rear of all those developed countries. And we were spending a lot more money than we were in 2004 for healthcare, and we're still getting so little for it. The thing that I did note is that we seem to be losing ground on equity and access to care. And part of the reason for that is because even people who have insurance are underinsured, and they are now having to pay, in many cases, thousands of dollars out of their own pockets for care before their insurance kicks in. So that's one big reason why we continue to be dead last. We're asking people with insurance even to pay thousands before they, can get care. And many people don't get care because they don't have those thousands to pay.
So that's very interesting, Wendell. My question was going to be, has this changed under the passage of the Affordable Care Act? But you answered that. Let me ask you this, though. What do you see as the most immediate reform we need broadly to our healthcare system?
I think that if you can, well, two things. One, we need to address the employer-based system. During the presidential campaign, a lot of the candidates said many times that we have over 150 million people who have coverage through the workplace. But that is failing us. You could have, if those candidates had been on the stage 20 years ago, they would have said the same thing and used the same figure. The problem is the country's gotten a lot bigger. Yes, we still have that many people, but far less as a percentage of the population are able to get coverage through their employer, and their employers have had no choice except to saddle their workers with these high out-of-pocket costs. Employers don't like this, and they are beginning to speak out. The Kaiser Family Foundation and Purchaser Business Group on Health recently had another survey that showed that the CEOs of the country's biggest corporations are saying that our current system is not sustainable for them over the next 5 to 10 years. So that's one big thing. And the other is, as I mentioned, doing something about these outrageous out-of-pocket obligations. The Affordable Care Act did set a limit, but it's far too high. Families, in some cases, are having to pay over $17,000 out of their own pockets before their coverage kicks in. So that has to be something that is addressed with urgency.
Yeah, can you just, from looking at all of these countries that you maybe examined, is there a country that we could look to say this is kind of what we need to sort of be moving towards?
We can learn from all of them, but the Congress and administrations have been unwilling to really look at what other countries are doing in any serious way. At different times, the survey has had countries that are leading the pack. The UK, I think the last time they did this was the top ranked. I think the Netherlands and Norway are among the top this time. The system in the Netherlands is more like the U.S. system in some ways than some of the others. I think the Norwegian system is a single-payer system. We can learn from all of them, but a lot of them are not strictly single-payer countries. The thing that is different is that they all have universal health care. They have some means, something that their governments have done to put the things in place that create a universal health care system, and we're far away from that. Even with the Affordable Care Act, we still have, I think, at least 30 million people who don't have insurance. And like I said earlier, many millions more than that who are underinsured. That's why we rank so poorly on access to care and equity. Our system is especially punitive to people of color and people who have low incomes. And that's why, also, it's noted in this report, why we have such an inequitable system, and that is getting more and more inequitable every year, despite the gains from the Affordable Care Act.
So Wendell, if I could jump in as the token conservative here on set, I really appreciate all of your points, and I think you raised some very valid ones. Looking at the report, it looks like the metrics by which they measure success in the rankings is, as you mentioned, accessibility, administrative aspects, efficiency, and equity. Equity being extremely important. But let me ask you, what do you make of the U.S. in terms of the quality of care? And I know we're frequently dealing with people coming from other countries because we are ahead at times in research and development, on the cutting edge there. Are we doing better there? Is that something you would agree with?
I would absolutely agree with that. There's no doubt, no question that we have some of the best doctors and hospitals and other facilities. We do tremendous research. The problem is that those great doctors and hospitals are off limits to more and more Americans, and that is a big problem, and it's getting worse. Yeah, I think anyone would agree with you that we have very, very good healthcare providers. But we have a system in which big insurance companies, like I used to work for, calling the shots and determining whether or not you will have access to those good healthcare providers.
Wendell, is when you compare the problem of the uninsured and the problem of the underinsured, which one is a bigger driver in the outcomes that you're seeing in this report?
I would say they're pretty equal. But maybe the problem of the underinsured is even worse. It's something I think lawmakers have not been addressing adequately. You can be paying a lot of money for premiums, and you and your employer can get it through the workplace. But if you are not able to cover what the obligation is for out-of-pockets, you are essentially in no better shape than the uninsured. And that's why so many people with insurance are going to GoFundMe to beg for money, turning to bankruptcy court, or putting debt on their credit cards that they'll probably never pay off. These are people with insurance. So I think that is a crisis, a growing crisis, that the policymakers absolutely must begin to address at both the state and federal level.
Yeah, Wendell, I want to move on here to this U.S. Department of Justice. You know, they're looking into claims by whistleblowers that Kaiser Permanente have been systemically defrauding Uncle Sam. So can you break down this report for us?
Yeah, and that was troubling because Kaiser has been considered one of the good guys. It's a nonprofit integrated healthcare system that owns hospitals and employs doctors, but it also has an insurance side. Even when I was in the industry, I was interviewing for a job there at one point. So I like the company. But what is happening is systemic. And we're finding that Kaiser is doing exactly the same thing that the big for-profits have been doing for many years. And I knew this from my time in the industry. I worked for Cigna and Humana for over 20 years. What they're doing is rigging a part of the reimbursement system for Medicare Advantage enrollees. And Medicare Advantage is the private alternative to the traditional Medicare program. They figured out, they being the big insurance companies, including Kaiser, that you can game the system. And you can claim that the people who are enrolling your plans are sicker than they really are. And that allows you to get more money from the federal government. And the Department of Justice and other entities have found that the Department of Health and Human Services, CMS, have determined that we are overpaying private insurers billions of dollars, sometimes through bonuses, but in many cases, just because they figured out how to game the system to get more money.
Well, Wendell Potter, thank you so much for joining us. Really appreciate it.
Thank you all.
And we'll have more Rising for you right after this.